Good afternoon. Thank you for asking me to give a talk today. Very briefly, those that don't know, Admiral Nursing is an intervention that's largely based upon case management of families affected by dementia. A significant portion of the role is not just the face-to-face work with the families, but also consultancy and supporting generalist practitioners, generalist clinicians, health and social care to care for people with dementia on their own caseloads. In principle, we work through from diagnosis right through to the end of life of the person with dementia, and then for a period of time in bereavement support of family carers. So we work with whole families, and now these days we're seeing multiple people with dementia in families, as well as being surrounded by multiple carers. So sometimes they can be very large family groups that we care for, and they can be very complex. Admiral Nursing is, whilst it's supported by Dementia UK, they are hosted by other organisations and hosts, very similar to the Macmillan model. So how are we adapting to our practice in light of COVID-19? I wanted just briefly to look at the models of Admiral Nursing. We have a telephone helpline which is 24/7, which is manned by Admiral Nurses. And in a way, this service has not been affected by COVID, simply because of the nature of how the service is delivered. It is a telephone and email helpline. We have largely the community models of Admiral Nursing, where they will work within the community within any particular locality or region, and work directly in families' own homes, or where the person with dementia or their carer is. So a community model nurse could actually support families where the person with dementia is in a care home, or where they're accessing social care services or what have you. We have a primary care-led model where often the nurses are working alongside GPs and primary care surgery staff. We have quite an increasing number that work with the hospice movement, and again, these tend to be outward reaching from the hospice, so very much community-based, working with families in their own homes. We also have acute hospital Admiral Nurses that work principally to ensure that the care and experience of family affected by dementia when admitted to acute hospital is the best it can be. And similarly, we have community models that are hosted by local authorities. Now that doesn't mean to say that they only deliver social care, they deliver holistic care, as do all the other models. And then we have peripatetic clinics that are almost like pop-up clinics that deliver the model of Admiral Nursing, but very much perhaps like the helpline in one-off calls, one-off interventions, but actually face-to-face in any locality. Now, all of our services, apart from the helpline, have been altered, have been changed because of the remote access enforcement and social isolation. Obviously in acute hospitals, hospice and care home settings, they are still very much face-to-face and obviously are having to apply to the PPE regulations and adapt their care accordingly. But what I am finding is that the model of helpline nursing has really supported transferability of knowledge and skills to the community-based nurses who are now having to deliver their interventions remotely, either through telephone or through video conferencing. So in a way, we've sort of taken this issue back to practice development and actually enabled very rapid learning of the community-based nurses. And I'll come on to that a bit later. Some of the immediate issues that we're experiencing are the heightened levels of risk, and how you can adapt your mode of practice to one that's remote and still have a sense of managing those risks and anticipating those risks. Now, we've had to work differently, and as I've said, we're developing quite a lot of knowledge in the community, learning by how the helpline nurses assess and report and manage risk. But what we are seeing is that some of the risks that we would have normally managed quite happily in the community are exacerbated by COVID. And I think this is something really important to bear in mind when practice is having to take on a completely different format. Now, a red flag for us is the ability and the confidence of the nurses to manage such risks over the phone. The risks are changing subtly at the moment, and as resources for families affected by dementia are being stripped away in preference for the focus being on acute hospital care, we're seeing carer stress and burden increasing massively. And what we're seeing as a result of this increased risk are, as with the general population, we're seeing increase in domestic violence, suicidality of family members. And so these nurses are having to manage, assess and coordinate services, scant services now, to manage these heightened risks. Now, Admiral nurses each come from different backgrounds, so they've got different perspectives of risk and different skills in how to assess and manage that. So we're having to very quickly bring all of these nurses, not just up to speed with working differently, but actually managing some of the tensions around risk and safeguarding quite differently. There's increased vulnerabilities as families rely on others for their basic needs and care. And whilst in the main that seems to be going fairly well and is driven by good community spirited interventions and individuals, we're still seeing some where people claim to be good Samaritans, but actually aren't. They're actually, these people are more exposed to the vulnerabilities of scamming and exploitation. So we need to be very mindful of this. And some of the other risks that we're seeing are the physical health needs of these families are being overlooked or potentially not fully assessed or managed, largely because other teams and services are having to adapt their practices and work remotely or avoid direct social interaction with some people who've got very complex needs. And there's an increasing perception that multidisciplinary teams are becoming more fragmented. And this brings with it an increased risk of disengagement of families who have got complex needs. So I just want to sort of finish really on how are we at Dementia UK supporting nurses to adapt their practice in a rapidly changing situation. We very early days, we set up a COVID-19 resource library. Now that's curated by our professional and practice development team. Now, because our practice covers so many different contexts, care contexts and settings and specialities, we had to make sure that this resource library is multifaceted. But we cannot expect these nurses who are very busy in the field to read or access all of the links that we offer, that we have available to us in the resource library. So we've identified members who are responsible, members of the practice development team who are responsible to titrate the key messages from those resources. What are the key messages that the nurses need to know, need to understand, need to immediately put into practice? We can't expect them to go in and critique evidence base for different interventions and different facets of their service. We have to give them the raw material. We're also developing remote practice development and clinical supervision. Now, Admiral Nursing I think are very privileged in that we have monthly regional practice development and clinical supervision sessions, but we have to now manage that remotely, but make sure it's of the same quality. So as with this webinar, we're having targeted webinars to support their working practices. So very focused ones on how to case manage over the telephone, how to case manage using video calls. And also it's making best use of our own resources regionally and locally to support individual nurses on not just on a one-to-one basis, but also within the teams that they're working with, to ensure that we can support their immediate problem solving, not just of clinical cases, but on service delivery, service organisation, and how to better manage their practice when working in a remote situation. So I hope this has been of some use to you. Looking forward to asking for you to ask questions and hopefully give you some positive responses.